In 2022, the United States Department of Health and Human Services, Office of Inspector General, released a report. And what that report found should have been front-page news. Medicare Advantage plans, the private insurance programs covering nearly half of all Medicare beneficiaries, were denying prior authorization requests at rates that would likely have been approved under original Medicare. Hundreds of thousands of requests denied for care that Medicare itself would have covered. Real people, real diagnoses, real doctors saying, this patient needs this treatment, and insurance companies saying, no. Today we are going deep on the Medicare Advantage denial crisis, what prior authorization actually is, how insurance companies use it, what the federal government found when they investigated, what your rights are when you are denied, and the exact steps to take when a Medicare Advantage plan denies your care. Stay with us, because if you or someone you love is on Medicare Advantage, this video could be the most important one you watch this year. Welcome back to Medicare Exposed. No commissions, no plans to sell, no agenda, just the truth about Medicare every single week. If you're new here, subscribe right now. Let's get into it. First, what exactly is prior authorization? Prior authorization, also called pre-authorization or pre-approval, is a requirement by Medicare Advantage plans that certain medical services, procedures, medications, or equipment must be approved by the insurance company before they are provided. Your doctor orders a procedure. Before that procedure can happen, the insurance company reviews the request and decides whether to approve or deny it. This review process can take days, sometimes weeks. And if the insurance company denies the request, your treatment is delayed or blocked until you either appeal or pay for the care yourself. Now, prior authorization does not exist in original Medicare. Under original Medicare, if your doctor orders a treatment, Medicare pays for it if it meets Medicare's coverage criteria. There is no insurance company in the middle, reviewing whether your doctor's clinical judgment is acceptable. That middle layer is a Medicare Advantage invention, and according to federal investigators, it is being used in ways that harm patients. What did the federal investigation actually find? In 2022, the HHS Office of Inspector General reviewed a sample of prior authorization denials from Medicare Advantage plans. The findings were alarming. 13% of prior authorization denials were for services that met Medicare coverage criteria, meaning the care was medically necessary. Medicare would have covered it under original Medicare. But the Medicare Advantage plan said no anyway. The investigators also found that 18% of payment denials were for care that had already been provided and that also met Medicare coverage criteria. Real care, already delivered, denied payment anyway. These are not rounding errors. These are systematic patterns that investigators concluded were likely to delay or prevent beneficiaries from receiving medically necessary care. The report specifically noted that some Medicare Advantage plans were using internally developed clinical criteria, more restrictive than Medicare's own coverage rules, to justify denials. In other words, insurance companies were making up stricter rules than Medicare requires and using those stricter rules to deny care. Why does this happen? To understand why prior authorization denials happen, you need to understand the business model. As we covered in video 5, Medicare pays private insurance companies a fixed monthly amount to cover each Medicare Advantage member. Whatever the insurance company doesn't spend on your care, they keep as profit, which means every denied claim is money that stays in the insurance company's pocket. Prior authorization, in its legitimate form, is designed to prevent unnecessary or inappropriate care. That is a legitimate goal. But when it is used to deny medically necessary care that Medicare would have covered, it becomes a profit tool at the patient's expense. The federal government has recognized this, and in 2023, new rules were introduced, requiring Medicare Advantage plans to follow Medicare coverage criteria when making prior authorization decisions. These rules were a step in the right direction, but enforcement is ongoing, and denials continue. What are your rights when Medicare Advantage denies your care? This is the most important section of this video, because most people who receive a denial accept it. They assume the insurance company has the final word. They do not. You have the right to appeal every single denial. And here is what most people don't know. The appeal process has specific timelines that the insurance company must follow by law. Let me walk you through the complete appeals process. Level 1. Redetermination. The first level of appeal is called a redetermination. You request that the Medicare Advantage plan review its own denial decision. You must file this request within 60 days of receiving your denial notice. The plan must respond within 60 days for standard requests or 72 hours for expedited requests. If your health condition is urgent, write a letter clearly stating that you are requesting a redetermination. Attach any supporting medical documentation from your doctor explaining why the treatment is medically necessary. Get your doctor involved in this process immediately. A strong letter of medical necessity from your physician significantly increases your chances of success at this level. Level 2. Reconsideration by an independent organization. If the plan upholds its denial at Level 1, your case moves to an independent review entity, a third-party organization that has no financial relationship with the insurance company. This independent review is one of the most powerful tools available to Medicare Advantage members because, unlike Level 1, where the same company that denied you reviews its own decision, Level 2 puts your case in front of an independent evaluator with no stake in the outcome. You must request Level 2 review within 60 days of your Level 1 denial. The independent reviewer must respond within 30 days for standard requests or 72 hours for urgent cases. Again, include all medical documentation. Include your doctor's letter of medical necessity. Include any clinical guidelines that support the treatment. The more evidence you provide, the stronger your case. Level 3. Office of Medicare Hearings and Appeals. If Level 2 upholds the denial and the amount in dispute is at least $180, you can request a hearing before an administrative law judge. This is a formal legal proceeding, and while you do not need an attorney, having legal representation, particularly from an elder law attorney or a patient advocate, can significantly improve your chances. You must request this hearing within 60 days of your Level 2 denial. The judge has 90 days to issue a decision. Level 4. Medicare Appeals Council. If the administrative law judge rules against you, you can request review by the Medicare Appeals Council. This is a federal appellate body that reviews decisions made by administrative law judges. You must file within 60 days of the judge's decision. Level 5. Federal District Court. The final level of appeal is filing a lawsuit in Federal District Court. This level requires that the amount in dispute exceeds $1,840 in 2024. And it almost certainly requires legal representation, but it exists. And it has been used successfully by Medicare Advantage members whose denials were wrongful. The most important thing to know about the appeals process. Statistics consistently show that Medicare Advantage denial appeals are successful at surprisingly high rates. A 2021 analysis found that when Medicare Advantage members appealed denials, they won a significant percentage of those appeals. Many people who accept an initial denial would have won on appeal. The insurance company is counting on you not appealing. Do not give them that. What to do the moment you receive a denial. Step 1. Read the denial notice carefully. It must tell you specifically why the care was denied and what your appeal rights are. Step 2. Call your doctor immediately. Tell them the denial reason. Ask them to write a letter of medical necessity, specifically addressing the denial reason. Step 3. Request an expedited appeal if your condition is urgent. You have the right to expedited review if a standard timeline would seriously jeopardize your health. Step 4. File your Level 1 redetermination immediately. Do not wait. The 60-day clock is running from the moment you receive the denial. Step 5. Keep copies of everything, every letter, every denial notice, every appeal, every response. Document every phone call with the date, time and name of the person you spoke with. Step 6. Contact your State Health Insurance Assistance Program, SHIP. They can help you navigate the appeals process, free of charge, with no commission and no agenda. The Medicare Advantage denial crisis is real. Federal investigators have documented it. Congress has held hearings about it. New regulations have been written to address it. But the denials continue. And the people most affected are the ones who don't know they can fight back. Now you know. If you or someone you love receives a Medicare Advantage denial, appeal it, every level, until you get the answer your doctor says you need. Hit subscribe and turn on notifications, because next week, we are covering veterans' benefits and Medicare, how they work together, what veterans are entitled to, and the costly mistakes veterans make when they don't coordinate these two programs correctly. We'll see you there.